Hello, good day everyone. I am Guadalquiver from BSN 12L Group 46, and so for today, I'm going to perform a proper demonstration about perineal flushing. So perineal care, it is a cleaning of the genital and the rectal area of the body. And also, this is done when the patient is in incontinence. And also, this prevents the spread of the microorganisms and prevents from inflammation and odor. So first and foremost is we need to check for the completeness of the supply in order to save time and energy. So first is we have the full warm water. We also have the basin which will serve as our bedpan. Also, we have the 7 dry cotton balls. We also have the 7 cotton balls soaked in antiseptic solution. We also have the sterile gloves. We also have the forceps. One is for picking and one is for working. And also we have the draw and the top sheet. We also have the antiseptic spray and the perineal pad. And also, don't forget to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. And lastly, provide comfort and privacy to the patient. So I already closed the door, fixed the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. Hello ma'am, good day. How are you feeling today? Okay, great. So it is important to greet the client in order to establish a good rapport between the healthcare provider and to the patient. So ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? Okay, when is your birthday? How would you like me to call you? Okay, great. So, Ma'am Jenny, the procedure that I'll be doing is I'll be doing perineal flushing. So, this is to remove normal perineal secretions and also it helps to prevent from getting inflammation and odor. And also, there are certain procedures that you need to follow. Is that okay with you, Ma'am Jenny? Any concerns or any questions? Okay, great. So it is important to explain the procedure of the assessment to the patient so that they will know how can they participate on the assessment. And also, before starting the assessment, it is important to wear gloves in order to prevent ourselves from the microorganisms. So now I'm done putting my sterile gloves, position the patient on a dorsal recumbent, and put patient on bedpan. This is to prevent from bed from soiling. And also, drape the patient, exposing only the parts to be covered because minimum exposure lessens the embarrassment and helps to provide warmth. Now, flush the perineal area with water. Note particular area of inflammation and also swelling, excessive discharge or secretions from the orifice and presence of odor because warm water is used to prevent from chilling and soften or dissolve blood clot. And now, get the cotton ball soaked in a cleansing solution with picking up forceps. So now, cleanse the external genitalia starting from the midline of the symphysis pubis down to the anus and never retrace the stroke. So for our first cotton ball is from the mons pubis down to the anus and discard. And with this is to prevent contamination. And with the second cotton ball, starting from the mons pubis in figure with 7 of the external labium towards the anus, because secretions that tend to collect around the labia minora facilitate bacterial growth. For our second cotton ball is from the mons pubis in figure 7 in external labium towards the anus and discard. And also do likewise on the other cotton ball. From the mons pubis in figure 7 of external labium towards the anus and discard. Now, with the fourth cotton ball, cleanse starting from the mons pubis in figure 7 by the way of internal labium towards the anus. So for our fourth cotton ball, from the mons pubis in figure 7 to the internal labium towards the anus and discard. And also do likewise on the opposite side with the next cotton ball. From the mons pubis in figure 7 to the internal labium towards the anus and discard. And now with the another cotton ball, cleanse the groin starting from the groin going up to the thighs, and use other side of the same cotton ball for the near groin. So from the groin down to the thigh and discard. And next is from the groin down to the thigh and discard. And now, flush the perineum thoroughly with sterile water. And using dry cotton balls, dries with the perineum with the same stroke as above. With the use of the another forceps. So for our first cotton ball is from the mons pubis down to the anus and discard. For our next cotton ball is from the mons pubis in the figure 7 into the external labium and to the anus and discard. And do the same with the another cotton ball. From the mons pubis to the external labium towards the anus and discard. With our fourth cotton ball is from mons pubis in figure 7 into the internal labium towards the anus and discard. And do likewise on the other cotton ball. From the mons pubis in figure 7 into the internal labium towards the anus and discard. And next is to the groin up to the thigh and discard. And do the same with the another cotton ball. From the groin down to the thigh and discard. Now, remove the bedpan gently and turn to the patient to the side. Now, if necessary, take one cotton ball and cleanse the side of the buttocks, then cleanse the other side of the buttocks and dry both buttocks. Discard. Discard. Now, turn the patient on her back and make her comfortable. And spray antiseptic as needed. This is to promote healing. So, Ma'am Jenny, kindly turn to your back, please, because we're gonna spray antiseptic solution. This is to promote healing, okay? Okay, thank you. And then put the perineal pad with an up-down motion as needed. This is to prevent the contamination of the vagina and urethra from the anal area. Okay, thank you. And thus aftercare of the mat. And record the treatment done to the patient and discharge as observed. And also don't forget to discard the sterile gloves. And also perform hand washing and hand hygiene in order to deter the spread of the microorganisms. And now document the treatment done to the patient and discharge as observed. So, okay, Ma'am Jenny, how are you feeling right now? After with our assessment? Okay, that's great to hear. So, Ma'am Jenny, do you have any concerns or questions that you may ask? Okay, great. So, Ma'am Jenny, thank you for your cooperation and have a nice day. And that's it. That's the proper demonstration of perineal flushing.